Hi, everyone. Welcome to our second session of the Working with Latin American Immigrants virtual professional development series. Today's session, this afternoon session, is COVID-19 in North Carolina's Latino communities. We are here with Dr. Hannah Gill, who is the director of the Latino Migration Project at UNC Chapel Hill. I want to go over a few kind of housekeeping sort of things before we move along with today's session today. A few Zoom etiquette reminders. Please mute yourself during the presentation. If you look down at the bottom in the left-hand corner, there's a button that you can click to mute yourself so as not to distract others from the presentation. To improve internet connectivity for all, please keep your videos off during the presentation. You can see that next to the mute button as well. And please use the chat box to ask questions for the speakers for Dr. Gill to answer during the Q&A session. You can find that right in the middle of the page. Feel free to type in any questions, and then when it's time for the Q&A, we'll go through and we'll answer those for you to the best of our ability. Okay, I'm going to switch it over now. Oh, sorry. So a few workshop session notes before we continue. The sessions will be recorded and uploaded to the UNC-DUKE Consortium YouTube channel at a later date. So if you want to go back and rewatch any part of the session, or if you'd like to share it with colleagues who are not able to be here today, they will be able to watch online. And presentation PowerPoints will also be sent to participants via email. So if there are any notes or links that you'd like to access, we will send this presentation to you soon. I'm now going to hand it off to Ms. Hannah Gill, who will talk to us about the impact of COVID-19 on the Latin American community in North Carolina.
All right. Hey, everybody. Great to see you all today. Thank you so much for joining us. I am going to transfer the screen to my screen. So if you will give me about 5 seconds, maybe a little more, I'm going to set that up right now. All right. So I can't see you all now. I can see my screen, but if for some reason you all cannot see my PowerPoint, then Corinne will let me know. Make some noise or do something dramatic so I can know. So thank you so much, all of you, for being here today. My name is Hannah Gill. I work at the Institute for the Study of the Americas at UNC Chapel Hill. And I really want to thank Corinne Zaragoza Estrella for inviting me to take part in this presentation today. And I'm really excited about the whole week-long sessions and all of the great interactions and exchanges that are going to go on over the week. So anyway, I look forward to talking to some of you later on in the session. Okay, so I'm going to be talking about immigrants as essential workers, the impact of COVID-19, and I'll go ahead and get started. So during the COVID-19 crisis, we've heard a lot about immigrants we've heard a lot about essential workers, quote unquote essential workers. While definitions vary, essential workers are people who are considered indispensable and have continued to work during the coronavirus pandemic. So think about the media that you've consumed over the past few months. If you're like me, you've consumed way too much media. And think about who are the people who are most frequently profiled as essential workers. So today we're going to talk about the role of immigrants as essential to the health, safety, and well-being of all North Carolina residents. We're going to take a look at how immigrant communities from across the state have been impacted by the COVID-19 pandemic. And we're going to consider some initiatives by local governments and organizations to support these essential workers and their families. And I want to point out that a transcript and then also all of the citations that I'm using in this presentation are available at a link that we are going to make available on the chat dialog box. And if you, we can also make it available to you afterwards. Okay. Let's see. So North Carolina, as we all know, is home to people from all over the world. And I'm curious to know what kind of global representation we have on the call today. So if you would like, share with us on chat what region of the world that you or your ancestors come from. Go ahead and share that. Nearly 8% of the state's population, which is about an estimated 800,000 people, were born in a foreign country. And if we look at the regions of the world, about half of the state's immigrants have ancestry in Latin America, a little over a quarter from Asia, 10% from Europe, and about 7% from Africa. If we look at specific countries, the top countries of origin for immigrants in North Carolina were Mexico, which is about 28% of our immigrants, India, which is about 9%, Honduras at 4%, China at 3%, and El Salvador at 3%. While immigrants reflect a huge diversity of experiences and backgrounds, and many share one common denominator: they or a family member were recruited to work in North Carolina. And the next slide I'm going to show you illustrates how this recruiting for some immigrants goes way back in American history. This is a slide of want ads from the 1980s on the right, and on the left is a famous photograph from Dorothea Lange from 1937 of a man who's traveling by train to the U.S. to work in the Bracero agricultural program, which operated by recruiting people from Mexico to come work in the United States. Many immigrants have been considered essential workers during the pandemic. For example, immigrants and refugees are critical to the healthcare industry, working as doctors, nurses, home health aides, cleaners, interpreters, and food service employees. In 2018, more than 2.6 million immigrants, including 314,000 refugees, were employed as healthcare workers. If you could guess what percentage of the United States doctors and nursing aides were born in foreign countries. So think about that. What percentage would you guess? So the answer is more than 1/4. So more than 25% of nurses and doctors, nursing aides and doctors were born in a foreign country in the US. And this percentage is even higher in low-income communities across the country where immigrants make up 42% of medical professionals. So immigrants are really on the front lines of the current health crisis. In North Carolina, almost 1 in 6 physicians graduated from a foreign medical school, while more than 6% of the state's nurses were born in a foreign country in 2014. Immigrants are also on the front lines of coronavirus vaccines and medicines. North Carolina, as we know, has one of the strongest biotechnology industries in the nation, with specialties that range from pharmaceutical manufacturing to health informatics. Biotech companies employ more people in North Carolina than in any other state, and recruit biochemists, biophysicists, and other scientists and engineers heavily from foreign countries. Immigrants represent more than 15% of all STEM workers in the state. North Carolina companies seeking a coronavirus vaccine or treatment are part of a group of major US companies that have together received approvals from the US Department of Labor to hire foreign workers with either green cards or H-1B work visas more than 11,000 times in the last decade. Another essential sector of our economy is food and agriculture. In the early days of the pandemic, empty shelves in our grocery stores reminded many people not to take the food supply for granted. Immigrants are the backbone of our agricultural system, harvesting crops and working in factories to slaughter and process chicken and pork. There are approximately 150,000 farm workers and their dependents in North Carolina each growing season. 94% of migrant farm workers in North Carolina are native Spanish speakers born in Latin America. North Carolina ranks first in the nation for its recruitment of H-2A migrant seasonal workers who come to work on farms. These are workers from foreign countries. While many immigrants share a commonality in their recruitment to work in the United States, the conditions of their employment vary in significant ways. While an employer cannot provide an immigrant employee with access, when an employer cannot provide an immigrant employee with access to a work visa or green card, the consequences can be devastating. Daily life becomes virtually impossible without a social security number, which is the key to unlocking so many social institutions, from driver's licenses to library cards to in-state tuition. The specter of deportation and family separation is constant for immigrants living without legal status. Before the pandemic dominated headlines, we can remember how news media frequently covered the crisis of undocumented immigration. An estimated 11 million people live and work in the US without legal status. More than 200,000 US citizens in North Carolina live with at least one family member who is undocumented. Undocumented immigrants and their families face disproportionate financial insecurity and poverty and work in industries that provide low pay. For example, the average annual income for a farm worker in North Carolina is only $11,000 a year. The biotech researchers and medical professionals I spoke of earlier are compensated with relatively high earnings and frequently receive an immigration visa sponsorship through their US employer. By contrast, thousands of new North Carolinians provide essential services but with very little financial compensation and no legal sponsorship from their employees. To add to financial and legal precarity, immigrants are employed in industries that have difficult and dangerous work sites. Poultry and pork processing factories have high injury rates due to the speed of production lines used for cutting up meat. Farm workers who pick crops suffer from heat stroke and pesticide poisoning. Undocumented workers have little recourse to legal aid in the case of workplace injuries or disputes. Foreign-born contract workers in restaurants, agriculture, cleaning and sanitation, hospitality, healthcare, and many other industries do not have health insurance. So now, COVID-19 has really increased these hazardous conditions, particularly in agricultural jobs where people work in close proximity. During April, COVID-19 spread through meat processing plants across the country, including in North Carolina. Companies closed factories and meat production dwindled. Until, let's see, actually, let me go forward. Companies closed and meat production dwindled until April 26, when President Trump signed an executive order to reopen meat processing plants. By the end of May, nearly all the plants had started back up. This mandate to continue meat production despite its human toll has had devastating impacts throughout North Carolina. So as you can see in this slide, there have been COVID-19 outbreaks at Tyson Foods in Wilkes County. They're in the green. Mount Air Farms in Siler City, that's a chicken processing plant. Smithfield Foods in Wilson and Tar Heel, in the blue, and several other factories. And these outbreaks have, sickened and killed workers and their families. North Carolina now leads the nation in outbreaks in meat processing plants. Ironically, these plants have been the site of deportations, ICE deportations in recent years, which have resulted in the detention and deportation of workers that federal leaders now label essential. The COVID-19 death toll has been greatest in African American and other communities of color. As you can see in this slide, epidemiologists are finding an alarming disparity in the infection rates among US residents with Latin American ancestry, and particularly those who live in states with more recently arrived immigrants like North Carolina. In 42 states plus Washington, D.C., Latinos make up a greater share of confirmed cases than their share of the population. And so if you take a look at this graph, now this graph has data that is now a couple weeks old. And as we know, things change quickly with COVID-19. As you see in this graph, here we go. In the gray, we have white Americans make up about 60% of the US population, but represent only 35% of COVID cases nationally. If you go down to African Americans make up about 13% of the US population, but have double the amount, nearly double the amount of COVID cases by percentage in the US. We go down to Latinx communities. We have about 18 or 19% of the US population are people who identify as Hispanic, Latina, Latinx, Latino. And we have, but they face a disproportionate impact in terms of COVID-19. 35% of the COVID cases are amongst people identified. Okay. So let's look at North Carolina now. Okay. So although here, okay, so take a look here. This is the total population of North Carolina. You can see that Latinos make up about 10% of the population. You look at that gray bar. They represent 43% of COVID-19 cases in the state. So look at the gray bar and you see that's the demographics of COVID-19 cases in North Carolina. And in some localities, if you look at this not as a statewide level, but you actually drill down to actual localities within the state, the data is even more stark. I learned just yesterday that in Forsyth County last week, 65% of COVID cases were in people who identify as Latino. So to compound the disproportionate impact of COVID-19, immigrants living and working in the US without a Social Security number are not eligible for federal unemployment benefits and the stimulus checks that millions of US citizens are receiving or have received during the crisis. Immigrant business owners accounted for nearly 12% of all self-employed North Carolina residents in 2015 and generated $1 million in business income, but have had difficulty accessing small business relief funds from the federal government due to language and digital connectivity barriers. This ineligibility and lack of access is unconscionable, given the fact that immigrants are suffering the highest rates of infection and death. They are on the front lines of the coronavirus battle as essential workers, and they pay billions of dollars in federal and state taxes annually. Some state and local government leaders have worked to support immigrant and refugee residents. So an example is California Governor Gavin Newsom has a coronavirus emergency assistance plan, and it was the first one to financially help workers with, at least the first state plan to help workers without legal status. Eligible immigrant families have been able to receive up to $1,000 per household. In North Carolina, local nonprofit organizations, grassroots groups, and some towns and cities are working hard to communicate with and provide resources for immigrant and refugee residents. So this is a slide that I just pulled off of our webpage, which I will share with you shortly to give you a sense of what I'm talking about, some of these organizations. Faith and nonprofit organizations across the state have set up funds to support people who are not eligible for the stimulus checks. They've assisted families needing quarantine housing, helped eligible immigrants apply for unemployment, and pressured meat processing companies to provide testing and healthcare coverage for sick workers and their families. Towns and cities that have established relationships with immigrant community organizations and created language access plans have been better situated to mitigate the devastating impacts of COVID-19. For example, the town of Chapel Hill passed a language access plan in November of 2019, right before the pandemic began, which committed resources to hiring bilingual staff and mandated that critical information be shared in 4 community languages: Spanish, Mandarin Chinese, Karen, and Burmese. During the pandemic, the town has released multilingual safety information and videos. They've sponsored food drives in locations accessible to immigrant and refugee residents, and they conducted a survey about resident needs in partnership with a community organization. The City of Charlotte created an Office of Equity, Mobility, and Immigrant Integration in 2019 with the goal of improving communication and enhancing access to government services and economic opportunity. When the pandemic started, the city quickly sent out messages in English on how to slow the spread of COVID-19 and worked to translate them into other community languages. The City of Winston-Salem, which has offered newcomer orientations for years in multiple languages, has mobilized community partners to disseminate information regarding fair housing law protections to residents with limited English proficiency. These practices illustrate what local governments can do to address inequity and limit the spread of COVID-19 in communities. Local governments should have a plan that details how departments communicate critical information to residents in an accessible language and make resources available to pay qualified interpreters and translators. And when I talk about local government, I speak of local government because I work specifically with local government as part of the work that I do at the Institute for the Study of the Americas. But a lot of these principles should apply to educational institutions and other community entities. Information is best shared through trusted community leaders. So it's critical to build relationships with organizations and people with deep connections to immigrant and refugee residents. Bilingual hiring policies and pay raises diversify staff and build a foundation for communication, ultimately reducing costs to organizations, to cities, to towns. Food and mask distribution should be accessible to low-income immigrant neighborhoods. And local governments and organizations should focus attention on high-risk places of employment, like meat processing plants, and promote safety practices and facilitate access to COVID-19 testing resources and quarantine housing. Most of all, leaders, and that applies to local leaders, local, state, and federal leaders, they must have a willingness to address the underlying inequities that have plagued so many new Americans in the past and made coronavirus so much worse in the present. If America deems immigrant workers essential, then leaders should provide access to the essential foundations of well-being, financial security, healthcare, and legal immigration status. So to learn more about leadership in immigrant and refugee communities in North Carolina, including our programs, and access the resources on our web pages, you can visit the Institute for the Study of the Americas Latino Migration Project. Here is the link. You can go to migration.unc.edu for short, and there's a COVID-19 tab where you can find bilingual resources on organizations that are doing this kind of work. You can learn more about local governments that I've just spoken about. And then we also have links to, I'll show you some more. Give you another example of some of the information that we have on our webpage. Here is, for example, this is a list of financial assistance for immigrants in North Carolina that pairs well with the webpage of Enlace Latino, which is the first one on the top list. They have a guide a guide of funds for immigrants affected by coronavirus. They have a very comprehensive listing, and this is in addition to those. So that's on our webpage. You can access that. And then let's see. We've also compiled some bilingual Spanish-English at-home learning resources. Over the summer, we've been working on a pilot program that provides online tutoring for children, elementary school children, students, and families that are learning English. And Corinne has been part of that as well and could speak to that. All right, so I think here's information about how to contact us Here's our general information about the Institute for the Study of the Americas, which you probably already have. And then in the next slide is just my email contact and our social media handles. I will go to that. Okay, that is the end of my presentation. Thank you so much.
Thank you so much, Hannah. We really appreciate you taking the time to be with us today. We did have one question already about the slide with the percentages about the number of people, the breakdown of race and ethnicity who have COVID-19. And there was a question about how the percentages didn't add up to 100%. So could you speak a little bit about the discrepancy there?
Sure. I'll double check that. It may be that I was just using the race and ethnicity with the largest percentages, but I'll double check that. If you want, I can get back to you. I'll double check that and get back to you. Thank you for pointing that out.
Okay. And if you have any other questions, again, please enter them in the chat, and I will bring those, and I can ask Dr. Gill those questions as well. Don't be shy. Okay. Well, I'm going to go ahead and give, here we go, so question. Can you share the slide to have access to the resources the presenter mentioned? Yes, we will be sharing all of these resources at a later date. We'll be sending out an email of all the presentations at the end of the week. So probably on Friday, keep a lookout, and we'll send out the not only the presentations, but we'll also be collecting all of the presentations and putting them on our YouTube page for people who are unable to attend today. And then for Hannah, do you know of any organizations doing bilingual at-home learning resources in languages other than Spanish?
Bilingual at-home resources in languages other than English.
Other than Spanish.
I'm sorry, I mean other than Spanish.
Mm-hmm.
That's a great question, and I don't know. I do not know off the top of my head, but I would be very happy to research that for you, and through connections that we have we work with a lot of different community organizations here in Chapel Hill that have connections, global connections. So I'd be happy to research that for you if you can leave me a contact.
Perfect. And if you also can share that with me, Hannah, and then I can include it, we can update it with the presentation as well. Awesome.
Perfect.
We have another question. I teach math to high schoolers and teach many newcomers. Is there a good video that I can share with them to educate them at the beginning of the school year regarding COVID, particularly something in Spanish for those students?
Okay. Are you looking for just sort of general info, like is there a specific dimension to COVID that you're interested in? Like the epidemiology of COVID, like who's being affected by it, or just more like public health information about how it spread?
We have health protection.
Okay, health protection.
Where like mask usage, that kind of thing.
Yes, okay. And just to clarify, are you looking for that in Spanish language?
Correct. Yes.
Okay, absolutely. I absolutely do have, yeah. So there is, we have links on our website to a number of really graphically, kind of very accessible and like graphically beautiful, like infographics about safety precautions. and they're bilingual. And we've developed a couple ourselves, and I'd be happy to share that with you, and also share with you links of where you can get that kind of information as it's updated. So again, if I can get your contact, I would be very happy to directly share that with you and with Corinne.
Hannah, is that the ESA website, or is it?
It's the migration.unc.edu, and if you go to COVID-19 resources, you'll see there's a number of there's a lot there, but I can just send it straight to you.
Perfect. I put it in the chat, migration.unc.edu. There's a special section in there for COVID-19. Barbie also just shared a really great page from Orange County, which has multilingual resources, I believe, not just in Spanish, but in also like Karen and other non-Spanish languages.
And
Chinese, Mandarin. Yeah, perfect.
And actually, that's something I forgot to say. Please send me, obviously our work in this, we try to be comprehensive, but it's impossible to be completely comprehensive and get everything. So if there are other links or sources that you know about that you feel should go, we should share, please send them to me. And the Orange County Health Department has done a spectacular job with health resources, and actually we have a lot of what you'll see on our page is Orange County materials, because they're doing such a great job.
Yeah. Any other questions that we can answer? Resources we can provide? Well, perfect. Thank you so much for joining us, Hannah, and for everyone who was able to participate in our session today. If you have any questions, feel free to email me. Our YouTube channel, good question, is not listed on here, but it's if you just look up UNC-DUKE Consortium, you'll be able to find our YouTube channel, and I'll also send out an email as well once we get those up with the link to that channel specifically, so you can access those directly. If you have any questions, please feel free to email me. I'm adding Hannah's email, which is hgill@email.unc.edu, to the chat. If you have any further questions, feel free to visit our website, find us on Facebook, Twitter, and Instagram. Tomorrow's session, we highly encourage you to join. You can use the same links that you used to access the sessions today. Our first session in the morning tomorrow is how administrators can create welcoming schools for Latina students. We'll have a group of local administrators who will be speaking about that and their personal experiences in the field working with Latino immigrants. And our second session in the afternoon is nurturing Latinx identity formation in learning environments, featuring our colleagues at Latinx Ed. That's at 2 o'clock in the afternoon as well. Okay. If you would like a certificate of completion for participating for eligible for CEUs, please visit go.unc.edu/COVID Latino. I'm going to put that in the chat as well. That way you can just take a very, very brief survey and we'll send you a certificate of completion as well, so you can get credit for CEUs for participation. If you need anything, please email us. Thank you so much for all the work that you're doing with the Latino communities in North Carolina and around the country. And I hope you have a wonderful day and a wonderful beginning of your school year. Thanks so much, everyone.